Part 1 of this chapter concentrated on type 1 or adult onset foveal macular dystrophy. We did this because adult onset foveal macular dystrophy is the most common of all the pattern dystrophies that you will see in practice. In this chapter, we'll talk about other styles of pattern dystrophy, and these will include butterfly-shaped, Fundus Pulverulentus, and central areolar sclerosis. August Deutmann first described the butterfly pattern in a family which had an autosomal dominant pattern of inheritance. The macula may have yellow, black, or white radiating patterns like wings of a butterfly. Here is an example of butterfly pattern dystrophy with yellow radiating wings. Fundus autofluorescence shows the hyperautofluorescence, where there's a buildup of lipofuscin in the yellow lesions. Here is another example of butterfly dystrophy with color and FAF. The wings are better developed in the right eye than the left eye. The OCT of this patient shows disruption of the ellipsoid zone centrally in the right eye. The yellow wings do not show up on this OCT. And the OCT even of the left eye is not very dramatic. Again, you can see some mild disruption of the level of the EZ layer, but again, the yellow wings do not show up. As with many diseases and dystrophies, the presentation is not always symmetrical. Here's a 49-year-old male who has vision of 20/30 in the right eye and 20/60 in the left eye. The butterfly pattern is better defined in the left eye than the right eye. You can see this pattern a little bit on the color photographs. On the fluorescein angiogram, this is a very typical spoke-shaped pattern of alternating hyper and hypofluorescent wings. This is a 44-year-old female who's had trouble reading for 6 months. The vision in the right eye is 20/20 and the left eye is 20/70. The color photographs show a radiating yellow butterfly pattern. It is fairly symmetrical, but just slightly different appearances in each eye. The fluorescein angiogram shows the areas of hyperfluorescence in the yellow areas and hypofluorescence wherever there is some pigment migration. Now, as you saw in part 2, pattern dystrophy can change over a period of time. Here is a 14-year follow-up of the last patient. Her vision has now dropped to 2400 in the left eye. You can see there are just a few remaining yellowish flecks outside a central area of geographic atrophy that she did not have at the first visit. The OCT again shows some very faint radiating defects peripheral to the geographic atrophy and an unfortunately very well-developed loss of the photoreceptors and RPE centrally. Here are some color photographs of a 70-year-old gentleman. His vision is reported at 20/25 in both eyes. You can see some very gross pigment modeling and changes, but there are no drusen in either eye. Now, there have been some reports that this pattern of the Fundus Pulverulentus has been seen with angioid streaks as well. This is a patient of Dr. Don Gass, who had vision of 20/50 in the right eye, 2400 in the left eye. The yellow lesions are more like a radiating butterfly pattern, but there's also a very coarse pigmentation. So as with many diseases, there may be a little bit of overlap on the clinical picture. The final group I'd like to present is type 4, or pattern dystrophy simulating Stargardt's. Most patients will have a good prognosis. This is a 58-year-old male who's had these lesions noted on a routine examination. The vision is 20/20 in both eyes. There's no family history of any degeneration, and the fundus autofluorescence shows these flecks very well. This is a patient of one of my colleagues, Dr. Mylan Brantley. This patient is 47 years old with vision of 20/20 in the right eye and 20/25 in the left eye. You can see the flecks on the left eye looks a little bit like butterfly. However, the yellowish flecks extend farther out into the peripheral macula than on a typical butterfly pattern dystrophy. This is the same patient of Dr. Brantley's, but with an FAF, which you can see on the top two photographs, and the red free photograph on the bottom photograph. The flecks and the extent are more prominent and extend further out than you could see on the clinical photograph. And here's more testing on the same patient. The top two photographs are near infrared, and the bottom two are fluorescein angiography. The ABCA4 testing was negative as no mutation was detected, and the perforin RP testing showed a heterozygous mutation for C629C greater than G. Typically, this is seen in autosomal dominant inherited foveo-macular dystrophy. Now, this example here is a patient of Dr. Anita Agarwal, whom she saw while at Vanderbilt, and was also published in the GAS Atlas. This patient is a 47-year-old African-American female with vision of 20/20 in the right eye and 20/50 in the left eye. She not only has type 4 pattern simulating Stargardt's, but she also has central areolar sclerosis.